Hey everybody, I was trying to clear my throat. How's everybody doing on this gorgeous Friday? I'm live at my favorite remote location, trying to work things out. It's been a busy day so far for me. The food box giveaway, and then I'm doing some conflict resolution sessions. So all of that is happening while, of course, everybody's excited about kicking off the weekend. We're working together to save our families, our communities, and of course, we are doing all this our way of life inside of a global pandemic. Thanks for watching Canceling COVID. I'm Tanya Rivens, and of course, we're grateful for our sponsor, Mecklenburg County Public Health, mecnc.gov, or you can check in with them at 980-314-9400. They are available to answer all of your questions. So let's get started by talking about something that's happening. We like to keep real talk and relevant. And let's talk about, what do you think about getting paid to find a job? You heard me correctly, folks. What do you think about getting paid to find a job? Well, North Carolina lawmakers have introduced legislation to pay people $1,500 to go off unemployment and find work. So, I think the unemployment is like $300 times four, 1,200. So they're giving you 1 month's pay to go find a job, and there are jobs out there. So let's talk about that. I'd love to hear feedback. Of course, that's our question of the day. Excuse me. What do you think about being paid to find a job? A lot of business owners say they're having a tough time hiring new employees or bringing back the ones they laid off during the shutdown because of COVID-19 unemployment payments. They're so competitive. For example, Carowinds has had to offer $500 bonuses. And we're talking Carowinds, the most fun place to work for seasonal hires. You can get a $500 bonus. Amazon is giving $1,000 for a sign-in bonus, and then an extra $100 to new hires who are fully COVID-19 vaccinated. And so people are getting creative. And if you recall, we had Skyline Restaurant on here, one of the prominent restaurants here in the city. And Jimmy Cocavisis, the owner, he showed, he shared very transparently about the challenges that he's having, and that if it wasn't for his family and for him working, they would have lost the business by now. So that's some really good information that we've already shared with you, and we see it happening more and more. So again, what do you think about people having to be paid to find a job? Here's your chance to have an open and real conversation with us. Jump in the chat. I see you hopping on. I'd love to hear your comments about that, because if people want to work, it's out there. Maybe they're concerned about being underemployed. Been there, done that before. But the opportunity is to get out. And if you really think about it, you're getting back into the swing of things, getting your exercise. And it's time to get up, get off that couch, get out of the house, folks, and start to get back to work. So with that said, I want to bring in our very first guest, talking with her this afternoon, rather. I've been going since about 6 a.m., not unlike many of you, because we're getting back into the swing of things that's keeping us pretty busy. But I want to get into our first conversation, and it's with Elizabeth Byram. She is the North Carolina child. Moving on to our first topic. And again, let me do justice to that intro. She's with North Carolina Child, and I saw this topic and I thought, wow, we really need to have this conversation, because COVID has created so many challenging and stressful situations for our children. And North Carolina Child is a nonprofit that prides itself on being a voice for North Carolina's children, and Lord knows they need an advocate to speak on their behalf. So I want to welcome our first guest again, Miss Byram. She's from NC Child, and thank you for taking the time to talk with us.
Thanks so much, Tanya. It's great to be here. Looking forward to our conversation.
Absolutely. So let's start by, and I'm having some trouble here with my teleprompter, but I'm going to get it right here. So NC Child works to eliminate the barriers that stand in our children's way. How has COVID-19 created new barriers or added to the existing ones?
Absolutely. We really do work to make sure that we're reducing barriers for all families and children, particularly families of color in North Carolina. And as you can imagine, the pandemic has really created a crisis for families. The workforce crisis for sure. We have families that are still out of work and looking for work right now. Families have struggled with food insecurity, other issues related to economic insecurity, and sort of the focus area that I like to talk about is childcare. So families who are trying to go back to work are still struggling to find childcare for their family. And we know that this existed long before the pandemic as well.
And that's a great point. When you talked about the food shortage, one of the things that my nonprofit is doing for the month of May is we're doing the Farmers to Families, those food boxes. And so we've been tackling that. In the first week, we had a little bit of a challenge, but after that, we've been getting those boxes out of there. Of course, we partner with some ministries, so it's great to see the work that you guys are doing. Now, tell us how NC Child works to help provide like nurturing homes and communities while helping families find economic security.
Absolutely. So that is absolutely our mission and our bread and butter. And we really do that by listening to our community and listening to families. And so a lot of our work is informed directly by families and children. We have a parent advisory council made up of incredible moms and dads from across the state who use Medicaid. We also have a youth advisory council who are able to provide that youth perspective about what's important to them. And so really being connected to our communities and allowing them to be involved in the state legislative process is incredibly important because we know that together our voices are stronger and we can really make change.
And it's so great to hear that you guys are talking to the youth. I told you I've had a busy day. I just came off a panel discussion with children talking about conflict resolution. And I say this because we need to talk to our kids. It's great for me to offer my opinions, but it's great that you're talking to them because they are the professionals and the experts. So it's been a challenging school year for so many families, academically and financially, of course, to kind of talk about how NC Child is making early child care and education available for most families.
Absolutely. One thing I think is really important to raise up is, like you said, the youth have such incredible perspectives. And around the issue of childcare, we actually heard from some of the high school youth who have younger siblings that are watching their parents struggle to find childcare for their younger siblings. And so for us, it's really important that we are thinking about early care and education from a holistic perspective. So we know that it's getting families access to affordable and safe care. It's also supporting teachers. Teachers right now are compensated at an incredibly low wage. Childcare teachers in North Carolina make on average $12 an hour. In many counties, it's actually less than that. And many teachers also don't have any benefits. So we know that we can't provide safe, quality care without a supported and well-compensated workforce. So that's another component of this important work. The last thing I'll just share is also supporting the programs and making sure they can stay open. So we've done a lot of advocacy around getting funds from the federal relief to make sure that owners and teachers can stay open to serve babies as they're learning.
And you just hit another important point, the whole issue of childcare. How do we get so behind the eight ball on childcare? I mean, it's not something that just happened all of a sudden. I have a son, and I know trying to find childcare and affordable, good quality childcare is a challenge for any parent. And now coming out of the pandemic, it makes it even tougher for so many families. And I'm sure you've witnessed that.
Absolutely. We do have a child care subsidy program in our state, which allows families to access financial support to find affordable care. However, as you can imagine, with the pandemic and increased kind of folks out of the workforce, that the wait list for subsidy has grown. So we're looking at a wait list of about 16,000 families that are waiting for care statewide. And then in addition, some programs have their own wait lists as well. And so it really is a challenge that has been decades long. And so I think we have a real opportunity to use a lot of this federal funding to shore up the system, to really invest in childcare. We know that birth to 5 are such important years, and having that quality education with loving and nurturing caregivers within the home and outside the home is such an important part of a child's development. And so I think our goal is to really make sure we're helping families access care and also investing in the system to make sure that it continues to serve families for years to come.
And Ms. Barham, unfortunately, before the pandemic, people somewhat had a choice. I think about with my child and my mom. She retired and she was able to see about him for the first year or so. But that's not even a choice now. People have been forced to deal with the whole child care issue, not voluntarily, and then trying to transition into daycare. It's got to be quite frustrating, and I know you hear that a lot too.
Absolutely. You really touched on an important word, Tanya, choice. Parents need those choices. And right now we're at a place where if childcare doesn't receive the funding it needs, they will not have choices. Centers have had to close during the pandemic. Some centers have been able to reopen, but maybe have lost classrooms because they're not able to get the staff to come back and teach children.
Wow. Well, I certainly appreciate you taking the time to talk with us. And I just have to ask you the question of the day. What do you think about getting paid to find a job, which seems to be the new norm, or a sign that wages just aren't competitive enough for so many. Because there's so many things that we can read into this. One-time bonus doesn't last you for 12 months. That's for sure.
Right, absolutely. I would say that, again, I think it comes down to making sure that families have the supports and an infrastructure to be able to go back to work. And so regardless of if families are being paid to find a job or in work, we really need to have affordable childcare. And families need to have peace of mind that they can send their child somewhere safe while they're able to go back to work.
Good stuff. So if someone wants to donate or volunteer, we had the information up before, but can you share the best way to get involved with you all?
We would love anyone to be involved in our work. You can find out more at ncchild.org. You can sign up there for our Child Advocacy Network. We love to have parents and providers and other community members be a part of that network. And we're always welcome to support folks in contacting their legislators to share their story.
Thank you, Ms. Byram. As I let you go, is there anything else you would like to share with those that are interested or that is tuned in?
Just to reiterate that childcare is essential, and we know it's essential for our economic recovery. And I encourage parents and community members to share your story. Talk to legislators about how this affects all of us. And if you need support with that, just let us know.
Absolutely. Elizabeth Byram, NC Child, thank you so much for taking the time to talk with us, and enjoy the rest of your day, by the way.
Thank you so much, Tanya.
Absolutely. Guys, we're having real conversations. We know that childcare is an issue, and the pandemic, just like everything else, nothing has gone untouched with what we're having to deal with throughout our entire community. And so we are so busy coming up with these conversations so you can hear from some valuable experts on what you can do to help. You can reach out, support NC Child. Also, I see you guys hopping on our question of the day. I'd love for you all to chime in and let me know. Now, North Carolina families could get checks up to $500. Listen to this. Governor Cooper has proposed a new plan called Extra Credit. It grants 2 points. It's a part of the $5 billion the state is getting from the Federal American Rescue Plan. So we'll see how that all plans out as we continue. NC Child has shared some information with us. We are now headed to our second guest to have a conversation. According to Amelia, hang in there, Miss NC Child, Miss Byram, she says she's having some technical problems. So that may be why you're still up on the screen. And looks like our next guest isn't coming up, but hopefully she'll get him up soon. But while we're doing that, I still want to emphasize that Met County Public Health is a supporter of canceling COVID, and they welcome your feedback and all your comments. You can go to mecnc.gov. Again, that's mecnc.gov. And Ms. Byram, if you want to give out the information one more time for NC Child, we run into these glitches from time to time, and we just take them in stride. So if people want to reach out and support NC Child, again, how can they find your website, and what's the phone number for them to provide for you?
Yes, our website is actually the best way to connect with us, and it's ncchild.org. And you can sign up for our email list and get connected to our events and our legislative updates there.
So how long have you guys been around?
Our organization has been around. We're moving on towards a decade of advocating for children in our current form, but the organization in various forms has been around for many, many decades in North Carolina, serving as the voice for children and families.
And that's some real powerful work. That's really God's work that you're doing when you're advocating for our children, because they are so precious. Do you think too many times or our legislators have just kind of overlooked the whole issue of childcare?
We continue to find that childcare is often underinvested in the state of North Carolina. And, not that legislators don't care about childcare. We think that it really is an issue that legislators across both sides of the aisle care about, but it really does require a significant investment. And that's something that we've continued to have to face as a challenge, is the underinvestment in childcare.
And I would say childcare is probably not much different from how there hasn't been as much as should be invested even in our education system. It seems to be in a whole turmoil as well. How do you guys find people through NC Child? Is it something they have to apply for? They have to come looking for you, or are they referred?
In terms of how the advocates that we work with?
That's correct.
Really, it's through our own outreach and kind of, again, working with communities directly through our various advisory councils. But we really try to share the word about the Child Advocacy Network. So another plug for our advocacy network, we actually have Friday morning calls now during session to let people know what's happening on the ground and what they can talk to their legislators about. And so that's a really great way just to be connected to us and to continue to bring people into our network of advocates.
And is that the way that people volunteer? Because I noticed, I put out there people want to get involved and volunteer. What are some of the ways that they can do that? I mean, when they sign up, what are they involved with?
Yes. So in terms of volunteering, really our volunteers are sort of just on the ground advocates. And
Okay.
so what they're signing up for is to get our action alerts, which allows them to reach out directly to a legislator, information about our events, which maybe invites them to be a donor or to be involved in one of our advocacy councils.
So you're doing great because we got this extended interview by fault,
Thanks.
which is no fault of yours or mine. And again, we've had technical difficulties in the past, but we haven't had any in a while. And so we're sitting here. I think that the issue is Dwayne Reynolds. Maybe he's having some problems. I'm trying to communicate with my producer right now. You can feel free to hop on off because I got some more stuff that I can fill in. But I want to say thank you again, NC Child, for taking the time to talk with us, Miss Elizabeth Byram, and we really appreciate you just sharing information because, again, child care is so important. So thank you again for taking the time to talk with us.
Thank you so much. It's been a pleasure. Take
Oh,
care.
absolutely. So as we continue, hopefully Amelia is good. I don't think we've ever had a situation where the guest wasn't able to hop off. I think if maybe she wants to X out, trying to communicate with her. Now I see that Mr. Reynolds is here and ready. I can tell you that Amelia is doing whatever she needs to do to get him set up. He's with Just Health Collective, and we should be getting him up shortly. In the meantime, I want to again emphasize that Mecklenburg County Public Health, a sponsor of the show, along with Groundwater Solutions, Dr. Tracia Black, people that are with us every week that do a pretty good job of dealing with us, hopping on and sharing vital information. There's also now an opportunity if you're interested in getting the vaccine. You don't have to have an appointment. There's Ms. Byron. She stepped away. I don't know if it's Amelia having some technical difficulties, but we'll figure out in a moment. But for anyone that if you're still kind of on the fence and you're trying to figure out if you are looking to maybe change your mind and now you're in a position where you really, really think you might just want to go ahead and get the vaccine, now is probably a good time to do it simply because what's been happening is you're starting to see more laws and rules and regulations that are going to roll out for people that are vaccinated versus people that are no longer vaccinated. And I just got to know that as we were getting started that some of these companies now for new hires, if you're not completely vaccinated, then you are not going to get a job. And, the one thing that kind of pushed me to start seeing more and more that we were heading down that path is Lollapalooza in Chicago. They are launching their outdoor event. They expect about 100,000. It's like 3 or 4 days. Every single day, if you're not completely vaccinated, you're going to have to get a COVID test. And you might say, oh, okay, I'll take the test, no problem. But what you're forgetting is what they're going to charge you for the test. So if I got to pay to attend an event and then I got to pay this astronomical amount to get inside the venue, it's not worth it, folks. And I know there's been a lot of doubters out there, a lot of concerns about what's happening, what's going on. But what needs to happen is that really rethink. I know it's a personal choice, but you're going to start seeing more and more trends on what's happening concerning COVID. Now, I can't communicate with my producer. She's on the public chat and I can't comment there. I've got Mr. Reynolds waiting. Apparently, she had some technical problems, and this doesn't happen often. So I don't know if Amelia's watching online. You're actually on the public chat, not the host chat, and I can't respond over there. So trying to keep this going, Miss Byram, we're tying up your whole afternoon. I don't know. You probably need to get back to your computer, and Mr. Reynolds is waiting to hop on. But you know what? These things happen, and we just kind of take them in stride. Lord knows we've had to adjust to this whole world of technology and remote learning or distance learning. And it's created some things that have come up. So while I'm still waiting on that, some great information that we have been able to share is that Amelia has been able to put the information. You see the scroll across the bottom. We now have our lowest amount of cases, which has been really great in nearly a year. We've been able to see a decrease in the amount of people that are passing away as a result of COVID. And that's all encouraging news. And I've had a lot of different viewers on expressing how they feel and what they feel about, having to be tested. And I'm trying to answer Dwayne now because I feel badly. He's waiting for Amelia. and she's not responding. So let me at least type in and let them know that she's having some technical problems. And if I could, for somebody that's on the public page, if you could just put in the chat, let Amelia know. I see my husband has hopped on. I see my sister's hopped on. Can you guys let Amelia know, because I can't type in the public chat, that she's in the wrong chat, that she needs to switch back over to the host chat, because she's commenting to me that she's logged back on and that it's her problem that she's having it, but it's on something that I can't respond to. So hopefully somebody listening or watching will hop on and make that reference to her. I probably need to really apologize to Mr. Reynolds because of this problem. You're waiting to hop on, and we're not able to bring you up because she runs everything through her board. She's the producer, so that creates a problem as well. And out of courtesy and not keeping Miss Byram on here, because she needs to get on with her day, I'm going to go ahead and wrap things up and see if we can get Mr. Reynolds rescheduled. So as always, life's challenges make you better, not bitter. I appreciate you all hopping on. Please join me this Sunday, Sounds of Inspiration. It kicks off at 7 a.m., 7 a.m. to 9:30. And hopefully you can tune in. I call it Inspiration and Information. If you'd like to be a guest on the show or like to share information, we invite you always to hop in. Follow us on Tanya Rivens Live. And you can email me, TanyaRivens@AOL.com. Again, that's TanyaRivens@AOL.com. So, Miss Byram, thank you for watching and sitting so patiently. I appreciate you so much. And again, normally we don't have a whole lot of problems, but it's just one of those days. So thank you. Thank you to NC Child and all the work that you all are doing. And you have a great weekend and certainly be safe.
Thank you so much, Shani. It was a pleasure to be here with you today.
You take care.